Thank you, Speaker. It's really lovely to see my Rotary Club here. My question to the Minister for Health. Recently I wrote to you regarding Bowral Hospital and the potential of increasing the capacity of inclusion of a new cancer treatment centre. Given space is optimal with New South Wales Health and the old ED is currently empty, will the Minister inform the House of Government views of my request and whether he will support the expansion of the cancer treatment for Bowral?
I call the Minister.
Yeah, very good question. I think all of us would agree across the political divide here that the member is a very fierce advocate for her community, works extremely hard in a community that is growing and is linked to the southwest of Sydney but also to the Southern Highlands and straddles those communities, and that can be challenging at times, and I recognise that. I do want to let the member know that I have read her correspondence and I'll get to that in a moment, but I do want to assure her that all public patients from Bowral and District Hospital that receive cancer care, including the important chemotherapy and haematology services at Southern Highlands Cancer Centre at the neighbouring Southern Highlands Private Hospital, and there are no out-of-pocket fees for public patients receiving care at this cancer centre. Now, the member will know that cancer services in all of our local health districts are networked. They're networked for a reason, so that we can move people around and we can provide the very best care in a geographical location, and that works far better than the Victorian model of care down their health system, which tends to be one-out hospitals, not integrated into a system. What we do in New South Wales is very different, and that's why, despite all of the challenges that I know we face and you know as local members we face, it is still arguably one of the best systems in the world. Mr. Speaker, I also note that at times there are costs that people can incur for that treatment, including from the members' electorate, and I want to make sure that members do know about IPTAS. That's the Isolated Patients Travel and Accommodation Assistance Scheme, designed to provide rebates and support for people accessing those types of cancer services. At the moment, in relation to the correspondence, I don't have immediate plans for a brand new cancer centre at Bowral and District Hospital. However, discussions have commenced, as the member will know, in accordance with the Clinical Service Plan, or the CSP, as a potential future opportunity for your community in line with current population projections. So whilst we don't have immediate intentions, and I can't announce today an immediate plan, we are looking at that particular issue as a part of our strategic planning for your community. Community consultation, and I want to assure the member for this because this is something that she has raised with me personally. I can assure the member that community consultation on this will continue to take place as part of any future health services planning for Southern Highlands, and I will be sure to engage with the member herself. She will know that the $123.7 million redevelopment of that hospital is being delivered into...
Member for Wollondilly. Additional 2 minutes is granted.
In 2 stages, and it is transforming the experience of patients, staff and community through high quality personal care, and importantly from my perspective, and I think the member's perspective, are purpose-built facilities designed to do what they need to do in a modern day healthcare environment. This redevelopment, as the member knows, was designed in line with clinicians as well as community members, health planners, our infrastructure experts and our broader team from New South Wales Health. This is expected to be completed next year in 2026. I know for the local member this can't come soon enough. There's considerable growth in her electorate. Her electorate, as I said, is quite unique given where it is geographically located. It hubs into parts of southwestern Sydney local health district, and it also hubs into services on the Southern Highlands. And for those in the chamber who do straddle communities like that, I get that can sometimes be a challenge, and I can assure the member that I am willing and will continue to work closely with her local community around making sure that particularly cancer services, and I say particularly cancer services because they are services that people often require frequent and ongoing treatment for considerable periods of time. Members in this House have undergone that treatment. The Deputy Premier is undergoing that treatment as we speak. That requires constant and frequent trips to hospitals. It is often very, very difficult, and trying to provide that as close to home as possible is something that I'm determined to see if we can do better and improve on. So whilst I don't have an announcement at the moment for the member, I can say that as a part of the clinical services planning that we are doing, we are willing and will continue to look at that so that we can look at delivering, importantly, better health services for your community.